the weaver of this church. Thank you for allowing us to use this beautiful edifice to be able to talk about this very important topic. I also want to thank Senator Chris Van Hollen. Thank you very much for allowing me to be a part of this, because I am really nobody with any of these wonderful, I'm just part of the community. I am you. So I want to thank you for allowing me this opportunity. And I am a registered nurse at Prince George's Hospital in the intensive care unit. I have lived and worked here at PG Hospital for 19 years now. And last but not least, I would like to also, I want to reach out and thank 1199 SEIU Union, which is our union at Prince George's Hospital, without which also I would not have been afforded this opportunity to have my voice heard. And one of the things that I'd like to point out is, most importantly, I want to thank all of you for coming out today, because you are the reason why we are here. This is a community effort. We must reach our goal. I'm wearing the button that says unity and power. Without that, we will not succeed. We've heard kind words from Senator Chris Van Hollen, the word mean. I'd like to exchange that for evil. The Bible says, and it tells us, that we are not to do evil, but to do good. What is good about taking food out of an individual's mouth? We've heard stories where they would have to choose between health care and food or shelter. This is America, the United States of America. We are one of the richest countries. We should not have to be in this position where we have to defend and fight for our rights. We have a right to health care. Your children, your fathers, your parents, grandchildren, great-grandchildren, everybody has a right to health care. So how dare they try to take that away from us? With that said, what do we do? As citizens of Maryland, we can stand together as one and continue to do what we're doing now, reach out and call our senators. One of the things that I would like to point out is that sometimes I look at this and I tell my daughter, and I've spoken with other individuals that don't understand what's really happening and what's at stake. Preventive health care is very important. Preventive health care dollars will not be available. People will not easily have access to preventive health care if this bill is passed. We cannot afford that. One may think, well, I can afford the health care insurance, but what about your father? What about your mother? What about your daughter, your sons? You know, it's not about us as an individual, but as a community. We have a social right and a social responsibility to everyone in our community, regardless of your race, regardless of your nationality. You have a right to health care. And I don't mean health care that's delivered late. I am sick and tired of seeing a lot of our patients in this community that come in for things that could have been prevented. Such as, let's look at hypertension, which is high blood pressure. I cannot begin to tell you how many times I had to stand by with a doctor and help them drill a hole in a loved one's, one of your loved one's head, in order to relieve the amount of pressure that is built up as a result of a rupture that occurred because of lack of high blood pressure medications. Can you imagine? How many people do you think will be able to afford high blood pressure medication without this preventive health care and the Affordable Care Act and Medicaid? We need that. We need that. It's just, it's really, it's inhumane that anyone should have to enter into the hospital because of a hypertensive bleed. And when you ask the loved ones of that individual, well, what happened? Did they not see a doctor? Were they not on blood pressure medication? Often the responses that we hear is yes, but he couldn't afford it. Yes, but he had to pay his rent. Or his grandchild, he made a decision to pay the grandchild's tuition or lunch, whatever the case may be. But the cost of high blood pressure medication, when you compare that to the cost of having to be dial 911, emergency service, straight to the ER, then to the ICU, OR, if you make it, a lot of our patients have died. So it is important that we do stand together as one, unite together in power, and make sure that this evil does not occur in the United States of America. Thank you.